In this video, we evaluate a tool to assist physiotherapy treatment using the Microsoft Kinect sensor. This video was produced by Ronnie Andrade and Leo Mercado as part of the eHealth and Biomedical Systems subject at the University of Melbourne. In this video, we will present a medical and technological background description for the solution, a description for the proposed architecture of the solution, and the evaluation of the solution using the health service and technology outcomes described on the eHealth lifecycle framework proposed by Koja, Drami, and Smith. Let's start with the medical and technological background.
What is physiotherapy and who needs it? Patients who sustain disability as a result of illness, trauma, aging, or congenital disorders, they require assistance from physiotherapists who are professionals in the assessment, diagnosis, and treatment through movement or physical means. Physiotherapists, they work cooperatively with patients to help them recover from injury, reduce their pain, and increase their mobility. The overall aim of physiotherapy is to promote independence, safety, and well-being, and result to an improved quality of life. A study done at the Alfred Hospital in Australia has found intensive physiotherapy has actually resulted in improved patient mobility following a trauma injury. However, patients' compliance to treatment is an issue that needs to be addressed. Patients suffering from low back pain have low adherence to physical exercises and therapies recommended by their physiotherapist. Another study done among elderly patients performing physiotherapy exercises guaranteed positive experience and provided support through positive patient engagement development.
From the technology point of view, the Microsoft Kinect was originally released in 2010 as a complement for the Xbox 360 video game console. Its objective was to allow players to interact with video games by using their body movements instead of just a traditional controller. Soon after the Kinect's commercial success, Microsoft decided to release a version for computer PCs, as well as a software development kit or SDK. The Kinect has been embraced for the development of real-life applications, and particularly in physiotherapy, it has proven to be a successful tool because it allows physiotherapists to work more efficiently and is more engaging for patients rather than traditional therapy. The proposed solution consists of a Windows PC connected to a Kinect sensor that is used both by the physiotherapist and the patient. The computer is in charge of running the main program. When a physiotherapist uses the program, he or she can record the exercises the patient should perform. He or she performs the exercises in front of the sensor, and the system converts them to a standard machine-readable format, such as XML. When a patient uses the system, he or she performs the exercises the physiotherapist recorded, and his or her progress is stored in a patient's database. Now we will evaluate the solution at its development stage. We'll discuss health and technology outcomes. Let's start with health outcomes.
On the development stage, there are four themes that appeared on the health services outcomes. This includes safety, cost and time, patient's acceptance or perception, and rethinking of technology. For patients having physiotherapy treatment is their safety. Patients may have disability or injuries that limit their body movement and physical activities, or they may have pain. Thus, safe performance of an exercise or treatment may be hindered and result to further injuries. However, a rehabilitation facility in Brazil successfully administered a Kinect-based game to patients with Parkinson's disease. The study used Kinect adventures and was found to be safe and feasible. Additionally, researchers noted improvement in their activities, body functions, and participation. Another concern for patients needing physiotherapy treatments are the associated cost and time. Traditionally, direct supervision of specialists in a clinical setting is required to achieve effective results. Also, patients are usually required to travel from a home care setting, and this results to more expensive and consultation fees and transport arrangement costs. However, a study on the use of games utilizing Kinect among children in physiotherapy and rehabilitation process has shown significant reduction in cost, increase in accessibility, and encouraging feedback. There is evidence of positive patients' acceptance of new technologies being incorporated into their treatment. In Canada, a group of rehabilitation patients who underwent total knee arthroplasty were introduced to a different mode of healthcare service called telerehabilitation physiotherapy services. The study involved a qualitative analysis of patients' experience, and the following are the main themes that emerge. First, there's a reduced need for transportation. Patients' need to maintain personal space was addressed while continuing therapeutic relationship with their therapists. So, more challenging but standard exercise programs were implemented successfully. Also, positive user experience of the tele-rehabilitation equipment, which just normally includes a Kinect, television set, and internet connection, was found to be easy to set up. And lastly, there was sense of ongoing clinical support. Another health service outcome is the rethinking of technology. A study done in Ontario, Canada points out an interesting finding when rethinking of technology for patients with chronic pain. Patients belonging to this group experience an emotional state that hinders exercise and activity regardless of physical activity or pain level. The study recommends studying the needs, barriers, and complexities faced by these people with chronic pain. Particularly because of the invisibility of the condition, it is often misunderstood and underestimated.
The technology outcomes we will focus on the development stage are development costs, interoperability, and standardization. To evaluate development costs during the development stage, we have divided them into hardware and software costs. Before the arrival of the Kinect, movement tracking technologies involved the use of complex hardware such as body suits or special sensors, which made body tracking technology too expensive to be used in consumer applications. However, the Kinect sensor is considerably less expensive compared to other movement tracking technologies due to its relative technological simplicity. Costs associated with software development are minimal also, because Microsoft has made all the necessary tools freely available for software development. Interoperability outcomes in the development stage are easily achievable, as any computer running Windows 8 is capable of running Kinect applications. In terms of standardization, Kinect applications run over the Microsoft's .NET framework, which is pre-installed in Windows computers. And to store the movements for the exercises the patients have to perform, a descriptive markup language such as XML could be used, which is a standard of the industry.
On the implementation stage of the eHealth lifecycle, health services outcomes that appeared are the assessment tool, diagnostic tool, knowledge transition, and treatment. An assessment tool, physiotherapists often assess patients' postural control, such as time standing and functional reach tests using their observation and judgment. When this information are available, they can implement a better therapy for their patients. A study in a clinical setting has provided physiotherapists a better assessment tool using Kinect to accurately quantify specific postural control mechanism of patients, including the forward reach, lateral reach, and single leg eyes closed standing balance. Kinect has been successfully implemented as a diagnostic tool for learned non-use of the paretic arm among post-stroke patients. LNU, or learned non-use, is usually measured by ZEBRIS, a costly movement analysis device. Kinect was able to measure LNU with similar results to measurements taken by ZEBRIS. So the study was able to conclude that Kinect is accurate and can be substituted to ZEBRIS in measuring maladaptive trunk compensation. Kinect was primarily designed for use in recreation, which became a challenge for its clinical implementation. In order for clinicians to implement Kinect in a clinical setting, a study has been done at 4 clinical sites by 5 physical therapists with virtual reality and video game expertise to analyze Kinect adventure games using a consensus building method to come up with categories that are clinically relevant, guiding game selection and gameplay. Treatment of children with cerebral palsy using conventional rehabilitation program with the support of Kinect has shown improvements in patients' balance and activities of daily living. The study was conducted among 11 cerebral palsy patients in an 8-week treatment. Baseline, post-treatment, and follow-up assessment were recorded. The results showed significant difference between pre- and post-treatment, and also significant difference between the baseline and follow-up assessment. However, there was no significant difference between post-treatment and follow-up evaluation, which indicated a long-term effects of the treatment with Kinect. Another study was conducted verifying the effectiveness of Kinect in treating elderly with balance problem. The study included 3 participants in a 10-week balance rehabilitation. Pre and post interventions were recorded. The results showed significant improvement for all the measures except for walking speed, which stayed the same for all the participants. Also, 2 out of 3 had an increase of lower limb strength. There was also notable satisfaction in the experience, and lastly, the study suggested the use of Kinect technology is an important adjunct to mobility treatment.
For the implementation stage, the desired technology outcomes for the solution are usability and appropriateness of the tool in different contexts. In terms of usability, Kinect applications for physiotherapy are well received by patients because they're not invasive, they provide a natural form of interaction, and they can be customized to use avatars to represent the patients and capture their attention. Furthermore, the use of avatars provides users with the necessary feedback for performing the exercises correctly. Additionally, an application like this is also appealing for physiotherapists who can record exercises for users to perform and observe time sequences and graphs, detailing patients' performance by exercise. Motivational features can also be integrated in a solution like this. There are several studies that evaluate the appropriateness of a Kinect solution in different physiotherapy contexts. One study argues that the use of avatars would make the application attractive to children undergoing physiotherapy treatment. In another study, the technology was used in patients who had reduced arm mobility after a stroke. And in another study, the technology was used to detect variations in static posture of patients with Parkinson's disease. All these studies presented positive outcomes, showing the validity of the Kinect as a rehabilitation tool in different contexts. After analyzing the feasibility of a Kinect-based physiotherapy tool from a medical and technology point of view, let's move on to the conclusions. Healthcare challenges facing all healthcare leaders nowadays include how to improve quality and accessibility and bring costs down. Federal and state healthcare systems struggle to balance these, especially restraining costs as technology continues to increase, population ages, and governments increased pressure to expand healthcare access. Physiotherapy service is not immune to these challenges. More and more patients need rehabilitation services to keep the community healthy and bring injured workforce back to service in order to sustain economic growth. With current advances in technology, the goal of delivering quality healthcare can be achieved as long as investments are leveraged properly to bring benefits used by healthcare consumers and improvements felt by investors. New technologies must be funded, and new generation thinkers must be given opportunities to explore ways to contribute to healthcare. Kinect, being first developed for recreation, draws enormous attention as it brings promising opportunities for real-life applications in rehabilitation as a useful, effective, and affordable option for assessment, diagnosis, and treatment tool. It also offers a widened accessibility and ease of use for both consumers and clinicians. The application in physiotherapy and other aspects of healthcare will no doubt facilitate effective transformation of individuals, communities, and the whole population as a large.